APGAR score is for, and what we doing?
APGAR score.
It's a grading system for the newborn. Go ahead.
To see if they can survive outside.
I love that, because that is what the answer I'm looking for, but go ahead, because I'm going to see if they can survive outside.
The inter-uterine world, like how they respond if they're doing well.
Okay.
How well they're progressing in
Okay.
breathing,
Once they
functioning.
are no longer dependent on mom, but what is it you said?
Their well-being.
Their overall well-being and need for what? Intervention. We are really seeing what their overall well-being is and if we need to intervene. Because how do we know what to do for that newborn without some scale to tell us? Because guess what? Unlike adults, if a baby has a heartbeat, we might still be doing chest compressions. Do we do that on adults? No, we do not. Okay? So we have to know if we need to intervene and what we need to do to intervene. Okay? Think about how traumatic it was to go through that birth canal and how much this baby has gone through. And go figure that sometimes it doesn't have the easiest time when it gets out into the world. But what do? Okay, so we use the APGAR score to know if we need to intervene. You have to be very familiar with the APGAR score. There are 1, 2, 3, 4, 5 components of the APGAR score, and guess what? They made it easy. Each letter represents something that you have to check on the baby. Okay? The first thing we're going to look at is their activity. Okay? Is the baby moving its arms? Is it responding appropriately? And we're going to give it a point system to decide on that. So if this baby is flaccid and not doing anything, they get a 0. Okay? If this baby is flexing its arms and legs a little bit, but not actively, they get a 1. If they are active, like we would want any newborn to be, they get a 2. Okay? The next thing is the P, that's the pulse rate. So we're checking a pulse on the baby. If it is absent, they get a 0. If it is below 100, so 99 or less, they only get a 1. If it is 100 or above, they get a 2. Okay? The point of resuscitation is 60. Okay? So that would be a pretty good heart rate for an adult, right?
Yeah.
Not for a baby. 60 is not okay. Okay? So, then we're going to look at their grimace or their reflex irritability. How do they respond to us? Okay? If the baby is completely floppy and has no reflex irritability or grimace, then they get a 0. If they have minimal response, I'm rubbing their back, I'm doing everything, and this baby is, they get a 1. Okay? If when I rub their back, it makes them cry and move and respond, they get a 2. Okay? I have no idea why that just went out. Okay, so what's the next one?
Appearance.
Appearance. So what are we looking at on the appearance? So we're actually looking at the cyanosis. Okay? So we're looking at central cyanosis or peripheral cyanosis. Okay? If the baby is blue all over, and guess what? It might be blue all over, they get a 0. If their center core is pink, but their extremities and lips are blue, they get a 1. If everything is pink and they have no blueness, they get a 2. How often do you think that happens? Almost never. Okay? It is not uncommon for a baby to have acrocyanosis, which means bluing of the hands and feet for 24 hours after delivery. So unlike, in the Olympics, babies don't usually get a 10, okay? Because this is where they usually fall short. Because it's not uncommon, up to 24 hours. So, the next thing we look at is their respirations. If they are not breathing, they get a 0. If they are making some breathing activity, but it is not a vigorous cry, they get a 1. Okay? If they are vigorously crying, they get a 2. Again, we may fall short on this, because sometimes what would he get? A 2, because that's a vigorous cry. So, again, we're going to do the APGAR not immediately after delivery. Okay? We do it at 1 minute and 5 minutes. Guys, that's a long time after a delivery. So you're not going to immediately, once the baby goes onto the warmer, from mom onto the warmer, assess that baby, but are you going to start intervening? Mm-hmm. Yes. You're not going to stand there. You're going to start stimulating that baby, drying that baby, doing everything you need to do, and then have to remember at 1 minute you have to do this APGAR. So how do we check a pulse on a newborn? In children we do. We have the benefit of having an umbilical cord that is still pulsating. I know. So we're actually going to pinch the umbilical cord and feel the heartbeat. Okay? And that's how we're going to, very good. It's pulsating, guys. So we're actually going to do a heartbeat that way. Okay? We do a heart rate for a full 1 minute. Okay? Most of the nurses have learned, and they're not. But guys, babies' heart rates are very irregular. Okay? So if you did a 10-second and multiplied by 6, it's not going to be an accurate heart rate on this newborn, because their heart rates are very irregular, just like in utero, that up and down movement, right? So, we want to make sure that we do a full minute, and we're counting. And guys, how fast is the heart rate going to be going?
110 to 160.
Do you think it's going to be hard to keep up with?
Yes.
So make sure you do some practicing, okay? So try to figure out, and normally when I'm doing it, I'll go like this so that I can help count, okay? So you might see the nurse doing that. Again, we're going to do it at 1 minute. If we get below a 7, then we need to intervene somehow. Now, remember what I said, that babies are really like a clean slate, right? Babies are a clean slate unless they have a defect. And most babies don't have a defect. So, disease process doesn't kick in until we've been out in the world and doing all the bad stuff we do. So, think of them as a clean slate, but unless they have a heart condition, are we ever going to really think cardiac in a newborn? No. So most intervention needs to focus on what? Respiratory. Okay? So when I'm resuscitating a baby, obviously if there is no heart rate, then I am doing chest compressions. Okay? But at the same time, I'm having somebody else doing respirations. Okay? If the heart rate is 60 or below, I'm doing chest compressions. Above 60, I am not doing chest compressions, but I'm doing positive pressure breathing. Okay? So we want to make sure we know what to do and when to intervene. So if it's below 7, then it depends on. If the heart rate is below 60, we're doing chest compressions and positive pressure ventilation. If it's above 60, we're just doing positive pressure ventilation. And if the heart rate is 100 and the baby is making some respiratory effort, then the only resuscitation is stimulation. Okay? Because most of the time, babies come out and they're just stunned. Okay? So we're constantly doing stimulation. How do we stimulate a newborn? Besides drying them off, we actually turn them over, we'll rub their back. Okay? He's getting nice and stimulated. Or we rub their feet. Okay? I need 2 volunteers. 2 volunteers.
I'll volunteer.
Okay, those 2.
I did yours too.
Have to be quick. Okay, ladies. So, I'm going to take his little outfit off. And so here is his blanket that you're going to use, okay? And keep in mind, and you can phone a friend if y'all get stuck, okay? You've got lots of friends around. Okay, so doctor places the baby. It's not a minute yet. What are you going to do?
Oh, sorry.
Dry him off. Stimulate.
Yeah.
And when I say, you're going to see, I had dads look at me like, you are so mean to my baby. Well, I'm trying to make sure they're okay. Okay?
Or is it someone like that was telling me that they tap their feet?
You can tap, rub, whatever.
Anything to get
But
them.
sometimes anything to get them stimulated can be aggressive. You know, don't hurt the baby, but you need to be aggressive. You need to dry them off. Right, they're not. Okay? So, again, it's a minute. It's a minute. So, I want you to do your ab guard.
All right. Activity.
Well,
Okay.
you see?
Yeah, his arms are flexing,
Okay,
but 1 point. Yeah, I would say 1.
okay.
And his pulse.
So, actually squeeze it.
You really feel it? I didn't feel it, but I don't know much.
Okay. Well, I don't have a second hand. Look, right over here. Look, on the wall. So while she does a pulse,
Yeah.
then you can be doing the next thing.
Grimace, reflex irritability. So is that when I just...
You're going to stimulate and see how he responds.
I would say minimal response.
Okay? But he is having some.
Some, yeah.
And, that's,
Appearance.
and so what I'm going to do for that is, let's say he did respond, okay, because that's the one we can't really get him to do. So he had a prompt response to stimulation, okay? So, appearance.
Appearance. He looks pink unless you're going to change him.
No.
His lips. I mean, don't look blue.
Okay.
Does, I mean, does
Kind of. This is not, but it does get worse. There was some acro. It was blue earlier. Okay, so 130 heart rate. Good job. Close enough.
I think it's 5. She says
It's not accurate?
I saw his mouth blue earlier.
Wake up.
She's grabbing by the legs.
So let's say his lips were blue and his feet were blue.
Okay, but he has a pink body.
But his body's pink.
So that's where it's a 6 right now.
Okay?
And then respiration.
So his respirations are 42. And he's crying.
Okay, so we need to intervene. No?
Do we?
Oh, that was close. It was below 60.
So is 42 normal in respirations for a newborn? Yes. What do you worry at what point? If it's above what?
60.
60. If it's above 60, except at delivery. Because you may have a respiration above 60, because again, it depends on if they were C-section or vaginal delivery. You can see why a vaginal or a C-section might have a harder time with respirations, right? Because they haven't gone through the birth canal.
What's the range for respirations?
So usually babies are between 24 to 60.
24.
Okay? So what is your APGAR?
8.
An 8. Do we need to intervene? No. So what are we going to do at this point?
Give it to mom.
Not yet, because again we need to do a 5-minute, because we do a 1 minute and a 5 minute.
What's the other?
But
The same thing.
the same test at 5 minutes. Okay? So again, you keep stimulating, you keep making sure he's okay. We do want to remove anything wet, because guys, there are 4 different ways of feed loss. You must know them for the test. Okay, so we're going to go through it again. No, we're going to go through it again, because I'm not going to do that to y'all. Okay? So he's still not working.
It says he's breathing. Is he breathing? Is his heart beating so far?
So, when we talk about breathing, I don't see him breathing, and
CPR.
is his heartbeat? That still has a heart rate, and he's still moving.
Average temperature.
Yeah, just like an adult. If they're warm, they'll stay warm.
Oh, this is why this came off from somewhere. Hold on.
Good job, Haley.
Now try. Now he's working. It was just a 2.
Put it closer, so.
Okay. So, very good, ladies. Y'all can go get some out of my bucket, my bag. So, I need 2 more volunteers. 1 and you. Because you were the one who asked earlier. 1.
And you.
I promise there'll be more people to volunteer. Okay. So, maybe I need to not.
But
Okay. So, hold on 1 second.
it doesn't.
Huh?
It doesn't. Rocky turn.
You didn't.
Make it throw up.
Man, Elliot, you wish you were like really tech savvy where you could like bump into that and make it throw. Gosh, I keep tripping over everything.
Yeah, try
Oh,
restart.
that'd be awesome. Challenge accepted.
Give me about 20 minutes.
I would feel like it'd be awesome.
Are you restarting?
And I'll go into the beach.
Okay, so I'm going to, huh? On the book, it says April.
What's this?
So, when does an apical pulse need to be obtained? Does it have to be obtained in the apgar?
No.
No, but you do need to get an apical pulse at some point. But when you're doing this, and you're trying to figure out if your baby needs to be resuscitated, you're not going to stop and go get stethoscope. Right. Now, eventually the cord is going to quit pulsating, so it's not even no longer a valid, right. So, would it be a wrong question? No. Would I test you on that? No. You know, you need a heart rate. Okay? So, okay, ladies. You are in delivery. So, the doctor puts the baby on the bed. What are you going to do? Do it. Start stimulating and drying, because heat loss from being wet is called what? Evaporation. We want to make sure that we're not losing heat from evaporation, because this baby is wet, okay? And once you use the blankets, then you get rid of the wet, okay? And get a dry blanket. We warm the blankets up ahead of time. Why do we do that? Because we don't want the baby to lose heat by what? Conduction. Conduction. Putting a warm baby on a cold surface will pull the heat. Right. Okay, so it's 1 minute. Do it. Do your apgar. So what's the activity?
So like a 1.
Okay.
He's not crying.
So he's responding, and he's moving his arms, and every time you touch him, he kind of squirms.
A 2.
Okay.
His appearance.
So this is pink. I mean, this is blue.
So a 1.
Okay.
And respiration.
So he's not really making any respiratory effort, kind of.
So a 1.
Okay.
Evaporation and conduction.
We're just waiting for the pulse. Well, let's change it. It was minimal. Let's change it. It was 1.
You have to intervene because they would show up.
And 134. So he got 1 point for activity. He got 2 points for pulse. He got 1 point for grimace. He got 1 point for his appearance. And he got 1 point for respiration. So he's a 6. What do you want to do? And how do you want to intervene? No, I said his face was blue, but his body was pink.
His respiration. Respiration.
So positive pressure breathing. Now, the first thing and foremost is keep stimulating. Keep stimulating, keep stimulating.
You do that.
But then you're going to get a bag and mask, and you're going to start giving positive pressure breathing. Okay? Sometimes all they need is 1 or 2. Well, hopefully, unless you see secretions, the doctor has already done suctioning. Okay? So you can suction if you see secretions, because that might be the problem. But you don't see secretions, you're doing positive pressure breathing. Sometimes, like I said, you're just going to do 1 or 2 bags and you're done. Okay? So it's 5 minutes now, and you're repeating your apgar. So, what's the first thing you're looking for?
Muscle tone.
Or activity. And so he's flailing his arms.
Okay. So the 2.
Okay? So he's flailing his arms and crying.
So we've got a 2.
Lips are still pink or still blue.
Blue mouth.
yellow warm, and his respiration.
He's screaming.
Okay, so that's.
Yeah. I mean, at this time, you could now do a nasal heart rate because, especially if you no longer resuscitate your baby. Okay?
After can you feel the heart rate?
Usually the first hour. But again, it depends on the baby. Okay, so what is our APGAR? A 9. So we've done a good job, right? Good job, ladies. Okay, so anybody have a question about APGAR and how we're going to obtain it? Guess what you're going to do on Thursday?
We're gonna do.
That's in the rodeo. Okay? So now we're going to do our other exam, which is our bowel.
Oh, they're smart.
Okay. So this is our Ballard exam. Yes. Yes, Ballard exam. Okay, so this is your Ballard exam. Why do we do a Ballard exam, and when do we do it? Okay, we're checking for maturity based on exam findings having to do with their gestational age. And so somebody said, well, gestation, that means when they were pregnant. Well, what we're doing is we're trying to see if this baby is really the age that her date such it was supposed to be. Okay, so we're trying to see based on exam findings. So we know Dr. Ballard figured out what a baby at 30 weeks should look like and has made this exam for us to do. So why do we care? Why do we care?
If they were preemie and they're younger DNA gestational age, their lungs may not be fully developed.
Okay.
Or
So-
neurological deficit, there might be others.
So there might be other risk factors if we find out that maturity-wise, they're not as mature as we thought they were. Okay? One big thing is that once we do the exam, we are not done. We have to graph to see, based on this baby's age, whether or not it is average for gestational age. Okay? So based on the exam we do, it's going to tell us how many weeks this baby is. We're not done until we turn it over and graph it. Okay? A Ballard exam is not done until we graph it. Because we know that babies who are average for gestational age are less at risk for two particular problems that newborns often have. And that is hypoglycemia, okay, and jaundice, hyperbilirubinemia. And we're going to talk about those two things. So we're trying to find, besides all the other things we know about the baby, whether or not they are average for gestational age or below average for gestational age or above average for gestational age, so that we can know to watch for hypoglycemia and hyperbilirubinemia. Okay? So, what do we need to do the exam? So, I'm going to ask for someone to come and volunteer. Anybody want to volunteer? Come on down. Very good. So, we're going to go through and we're going to examine the baby and decide where it falls in the Ballard score. Okay? So the first thing we're doing, and we're looking at these pictures, and guys, the nursery nurse has this in front of her. Okay, I guarantee you she's looking at these pictures. So there's no, like, I have to memorize, but you do need to identify what's in the ballot. Like, you have to know what type of things we're looking for, but you don't have to memorize what it means. Okay? So you're looking at the baby's posture. So you're looking to see if their legs are flexed like that, if their arms are flexed. So choose one of those pictures that you think this baby is most like. Okay, a 2. Now look at the legs. So we have some flexion. Actually, we have quite a bit. And sometimes it's going to fall in between 2. Okay? And this baby has some bend to the arms. It's not completely straight. Okay? So, now, I want you to know, let's say he chooses 2 and I choose 3. Let's say that. It's okay. It comes out in the wash. And you're going to see that. Because again, I don't need to know that this baby's 36 weeks as much as I need to know that if this baby by exam is 36 weeks, it's still by its weight within that 10 to 90 percentile. Okay, so it comes out in the wash. So again, you don't have to be perfect on it. So let's say you give it a 2. Somebody keep track of his numbers. Okay. So now we're doing the square window. Okay, and this is going to be a little hard on this baby, but a real baby, you can do this. You're bending the baby's arm at the wrist all the way down.
What?
All the way down. Okay? Newborns who are mature have greater flexibility in their joints. Immature babies aren't as flexible. So an immature baby is not going to bend. Like, we can't do it to ourselves, but it's not going to hurt the baby. And so a more mature baby, like if I was really a baby, like you're actually looking at this angle, okay, and pushing the hand all the way down as far as it can. And in a mature baby, it's going to go all the way.
How do you know it don't hurt?
Because they don't really cry. It doesn't hurt. Their
bones
joints
aren't
are so
fused.
flexible, and it's really their joints that are just so flexible
Our
that
stuff's not fused
they don't
together
bounce, but babies are not as hard as you think. So let's say it was this much. Okay, so give him another 2. Okay, so arm recoil. So now what you're doing is you're taking the baby's arms, going up and down at the wrist, okay? And I usually flex a few times, and then I pull down, and I let go, and if the arms recoil all the way, then it's more mature. You see that? If the arms come back all the way, a premature baby is going to be like this. Like their arms aren't going to recoil. Okay? So let's say the arms recoiled all the way to 90 degrees. So let's give them a 4. Okay? So the popliteal angle, guys, is actually, you're taking, and I can't do it on this baby, you're taking the knee and putting their knee on their abdomen with their leg bent. And once it's on their abdomen, you're pulling the leg as far as you can go till you feel resistance. Don't keep pulling, okay? But it's that angle that you can get the leg, and that's what you're evaluating, okay? So let's say you got a 90-degree angle when you pull the baby's the knee to the abdomen, and you pulled the baby's leg up, it was able to go all the way straight up and down, okay? So we got another 4. Okay,
Does that mean they're further along or further behind?
right, because if the more flexible the baby is in this case, so the more it gives, the less muscle tension they have, the more immature they are. Okay, I know. Muscle tension, I know, if you think about it, muscle tension and muscle pliability in premature babies are not there, but joint flexibility is there the closer they are to maturity. You with me? Okay, so their joints are much more pliable, but their muscle tone is a lot worse the more premature they are. Okay? The scarf sign, again, has to do with muscle tone and flexibility, not so much joint, as well as body mass. So what I'm doing is I'm pulling the baby's arm all the way across their chest to see how far their elbow goes onto their chest. And I'm comparing it to midline. Okay? So this baby, if I was doing it, doesn't even get on the chest. Okay? So what number would you choose for that?
1. -1.
Look at it doesn't even come onto the baby's abdomen. So look. Now, I want to, so 0 minus 1 means that arm went all the way across. Okay? All the way across. That's a -1. If that baby's arm goes the elbow, and it's the elbow that I'm looking at, okay? If that baby's elbow goes to the opposite breast, that's a 0. If that baby's elbow goes to the mid part of its, no, that's a 1. So the other breast is a 1. If it goes all the way across and onto the other side, which I can't even demonstrate, that's a -1. If it goes across and to the other side of the body, that's a 1. If it goes to the opposite nipple, that's a 1. Okay. No, that's a 1. If it goes to the mid part of the chest, that's a 2. If it comes onto the chest but doesn't go across, that's a 3. And if it won't even come, like you can't even get it, that's a 4. Okay? So the more mature a baby is, the less flexible they're going to be because their muscle tone is keeping that muscle from being manipulated. Okay? So I would say this is a 4. Okay? That's the scarf sign. Now, the head to ear, or the heel to ear, you are literally just taking the baby's heel and pulling it all the way as far as you can. And now that the knee's going to go to the side as opposed to when we put it on the abdomen and pulled up. So this one, we're just pulling it to see how far we can get it to their ear. Okay? So what would you call this? So we kind of have like a 90-degree angle. So I would say a 3. Okay? So, will you scroll up so we can see the other part? So, that's one part of the balance exam.
Can you go over the arm angle again?
Okay, so what you're doing is you're just doing this with the baby's arms and then holding it down and letting go. And the baby's going to either recoil or not. The less mature, you're not going to get recoil at all. Okay? The more mature, it's going to pull up. Now we're looking at the skin. Now, keep in mind, has anybody ever watched one of these videos of a baby in utero? Well, we're going to today. And so their skin is see-through in utero. Well, guess what? If they're born premature, it's see-through. There is no skin turgor protection in a premature baby. So what we're doing is we're looking to see how see-through it is, as well as in utero, a baby has vernix. Has anybody heard of vernix? That's the cheesy substance. Okay? Well, the more mature it is, that vernix is actually protecting the skin in utero. So the more mature they are in utero, it goes away. So a mature baby should be born with no vernix at all. Okay? So what happens is if a baby goes over 40 weeks and it doesn't have protection, what would happen to your skin if you were in water for a week? Okay, it's going to start reacting to the water and drying and cracking. So the more mature a baby is in utero, the more, once they're born, the more their skin is going to look like they've been in water for a given amount of time. Just turn it off.
The baby's off the bed.
Huh? Yeah. So, again, that's what we're looking for. We're looking to see, and it will get all the way to where it looks like leather. The baby has a leathery skin just because it hasn't had burnets to protect it while it was in the water for that long, okay? So we're actually looking to see, so do you see any, what you're doing is you're really looking to see, do I see any veins? Is it clear and almost shiny versus just normal skin tone without cracking, without anything, and you will literally see along the creases cracks in the skin, okay? So this baby, do you see any cracks? Do you see any veins? So this is the problem. This is one of the real problems though, is does it really match any of these? Because in number 0 minus 1, I think that would be 3. We might have to scroll up just to get our numbers, but in the superficial peeling in our rash with few veins versus cracking, pale areas, rare veins, see how it's like it doesn't really match either of those, right? So what am I going to choose? Well, I'm going to choose the one that is the best. So just scroll up one time and then we're going to keep our numbers square. Okay. So it's not really visible veins. And there's no, so again, either a 1 or a 2. You got to split the difference, but you can't do 1.5. Okay? So choose the one that's most appropriate. So let's do 1. I'm okay with that. Now we're going to look for lanugo. What is lanugo? Does anybody know? Hair. Okay? So it's that fine hair that babies have that they lose after they're born. Okay? And so now we have to keep in mind that genetics may cause this baby to be hairy, and that's normal for them. Okay? So what we're looking for is that fine hair. So you really literally have to turn your baby over. Good job. Support the head. Good job. And you're looking here. This is usually where you're going to see it a lot. The fine hair. Okay? Do you see any lanugo? I don't see any either. So we're going to put now. Look how it goes. None, sparse, abundant, thinning, bald areas, and mostly bald. Again, you know now the least mature baby is not going to have lanugo. Okay? And the most mature baby is not going to have lanugo. But based on all your other findings, do you think this baby's premature? No. So we're not going to choose none. We're going to say he had it at some point and he's lost it. Okay? So we're going to choose mostly bald because really we don't see any at all. But the closest to that is going to be mostly bald. Okay? So if you choose none, which there isn't none, but that would mean that he never had it. And I can guarantee in utero he had it at some point. Okay? It's not immature to the point where he never developed the lanugo. So now we're looking at the plantar surface creases. Okay. So we're actually looking at the bottom of his foot. Okay? A baby that is immature will have no creases at all. It's just smooth. Nothing's there. Then creases start developing at the anterior aspect then it will go to 2/3, and then it will go to complete. Okay? So we're actually evaluating, is it over the entire surface of the foot? Yeah, I would say so too. Okay? So it's over the, creases are over the entire sole. So what are we going to give him? A 4. Very good. So, breast buds. Now, again, we're not looking, we're just seeing if they have developed the breast buds. A premature baby will have the areolas with no tissue underneath, and they might even have dimpling where it goes in instead of out. And then we're truly measuring the size of the breast buds that we can feel. Okay? So you're going to feel to see, is there any breast buds there? Yep, there are. And so now we have to know how much, okay? Because it's going to be 1 to 2 millimeters, a premature baby, all the way up to 5 to 10 millimeters. You got a 3? Very good. I would say 2. 3 to 4 millimeters breast buds, okay? Again, you might have to take your measuring tape out until you're developing. And do you know how much a millimeter is? Because I guarantee you a millimeter is not on your tape measure. 10 mil, oh, that's great. So now you see, have something to go by. 10 millimeters is an eraser, okay? But again, 10 millimeters is also what? A centimeter, right? 10 millimeters is a centimeter. So you do have centimeters on your tape measure, okay? So you might have to pull that out. See, y'all thought that we're just done converting, right?
So that's the iteration of that?
You're feeling, yes. And now,
So if you're going to be in this situation, maybe get in tape that gives you
I mean, you can, but you're going to have a tape measure on your table because guess what you're going to measure your baby? Right. So, and we're going to talk about that too. Okay, so now we're looking at the eyes and ears. What do we know about premature babies? Their eyes are fused, and then they open. And then their eyelids are so clear you can see their eyes through them if they're real premature.
That's cool.
Right? And then they start developing cartilage in their ears. Okay? So you can visualize their eyes, but you're really evaluating their ears. Okay? So you're actually checking to see if there's thick cartilage on the ear and whether or not it recoils. Because a premature baby, if you did this to them, it's going to stay there. Okay, if you do this to a premature baby, it's not going to bounce back. It's going to stay there. Okay, so that's your recoil. Whether it's ready recoil, formed and firm, instant recoil, or thick cartilage with your ears soft. Okay, so what would you say with your baby? Of course, we can't do recoil, but let's say it recoils really well. A 3. So let's do 3. Now we're looking at genitals. Okay? There's the male and the female. We're not doing both, obviously, right? So we're actually evaluating whether or not they have these characteristics. So scroll down just a little. We have to remember where our 3s are. And so, I don't even think it has genitalia. So in a male baby, what happens is that we all know that the testes are up, okay, until it gets close to maturity, and then it comes down. And so we truly have to feel both testes. And sometimes it's not easy, and sometimes you have to go all the way to their groin and go all the way down to find it, because it might be still descending. Okay? Right. So you need to feel both testes, because if you don't, what do you need to do? Notify the doctor, because they have to descend. And we're not going to do anything right now about it, but the doctor needs to make sure that he's aware of it. Okay? So we're checking to see if they've descended. And then we're looking at the rugae. What's the rugae? The wrinkles, okay? An immature baby doesn't have rugae. It's just smooth. As it develops, it has a little bit of rugae and gets a lot of rugae. And then it becomes pendulous. So does anybody understand what I mean by pendulous, or do you want me to describe it? Are we good? Okay, so pendulous, like an immature baby, their scrotum, or their testes, and yeah, their scrotum is tight up against their body, okay? Pendulous is when it hangs. So when the testes hang, then that baby's more mature. Okay, the more mature the baby, the more it will hang and be pendulous. Okay? So, in the female, you're actually just visualizing without opening or moving anything, with the baby's legs kind of closed. Okay? And we're looking at how the labia majora lies over the labia minora, and how much of the labia minora we see, and if we see the clitoris without any manipulation. An immature female newborn will have much more labia minora, up to being able to see the clitoris, because the labia majora has not completely formed over it. A more mature baby, it will be completely covering it. Okay? So let's say this baby had few rugae with descended testes. Okay, so we're going to give him a 2. You go up and make sure that is a 2. Okay, very good. Good job. I know. Okay, so what is our score? You can come and use this with me. 36. So, I'm going to switch things back here. 36 is our score. So you see this, we're going over here, and we're finding our score right here. So the closest there that it comes to is 35. Okay? So it's not even, I mean, if it was like 38, then I would split the difference and go in between the 38 and 40. But because it's 1 over, I'm going to say this baby is 38 weeks gestation by exam. Y'all see how I got that? Okay? So it's 38 weeks gestation by exam. So now, am I done? No, because that doesn't mean anything. What means something is now I'm going to go over here. Too many things open, that's so much to share. Right? Let me find it, the other side. Okay, so now I'm going to flip that sheet over, and on the other side, I'm going to get this baby's measurements. Okay, so, and we're going to do measurements because I forgot to bring it up here, but I have tape measure because I was prepared. We're going to actually measure this baby, okay? And so we're going to get the measurements, and we're going to go from there. So how about we take a break? I think this is a good next stop.
Hi.